All right. Well, first of all, I'm a general doc, just a general physician. I'm not a family practitioner, I'm a general practitioner. I've been doing general practice for about 40 years and have made my specialty cannabis. I think cannabis found me as much as I found it. I found it in college and then was very interested through my education to see what was up with this most interesting herb. And so over the decades, I have been in a situation where I was relating with patients using cannabis and learning from them what cannabis was doing for their medical problems. And then when the law changed here in California, it was an easy move to go on into cannabis as a practice. So I've been a cannabis consultant here in Sebastopol for the last 16 years. And well, really, I go back a step to say one of my mentors in this role as a cannabis specialist was Todd Micarea. Quick show of hands, who knows Todd Micarea? Okay, thank you. Todd has passed away in 2007. He was a physician in the Bay Area who, in his career, went on to the National Institute of Mental Health in Washington, D.C. And one of the things he was charged with doing was to do some research about medical uses of cannabis. So he wrote a book about the use of cannabis as published in the English language, papers that had been found up until the banning of cannabis in the 30s and really disappearance more or less in the 40s. Todd was really quite stunned by the fact that cannabis was useful for so many conditions. And so as he moved into a private practice in California after leaving NIMH, and actually he was kind of forced out of NIMH because he took a liking to cannabis, and that essentially blackballed him from the scientific community in Washington, D.C., which was not wanting to see cannabis as medicine. This goes back to really a big step was Nixon, and prior to Nixon it was all the way back to the banning of cannabis, or at least making it inaccessible back in the 30s and on into the 40s. So Todd was one of my mentors, and I owe a lot to him about bringing our knowledge of cannabis as medicine forward. So as a general practitioner, I see people from infants with medical problems to the elderly with dementias, pains, insomnia, and all the other medical problems that go along with the aging process. And I really enjoy this practice. It's so interesting because it's so effective. We'll get a chance to talk more, but perhaps when I send people out the door with making a cannabis approval or cannabis recommendation, generally I send them out with some instruction as to what they might be looking for and how they might be using it. But an awful lot of this is tempered with the fact that there's a huge range in dosage and really quite a range in the strains of cannabis that might be available to them. And so, for some people, they give up early, and for other people, as I encourage them to, they keep looking at other strains and other ratios of cannabinoids that might work best for them. And I think we'll have a chance to talk more about that, because for those growers out there that are relating to patients, I think there's some key issues that you should be aware of that I think we'll get a chance to speak about. Nice to be here. Thank you, Sarah.
I want to welcome Martin Lee, who is an author of a political history of cannabis, which is called Smoke Signals. He's also a researcher looking into the benefits of CBDs and founder of Project CBD, also based here in Sonoma County. Welcome.
You know, we launched Project CBD in 2010, shortly after the first CBD-rich strains, as we call them, CBD-rich rather than high CBD, because of the different psychoactive effects that these strains have. And it's been amazing to watch the CBD narrative as it's unfolded since then. Fred Gardner and I, Fred was with the Society of Cannabis Clinicians, which played a major role in launching Project CBD. We suspected that it could be very significant once these strains became present as a result of the analytical labs testing strains and finding some CBD-rich strains. Because we had heard at these science conferences about the amazing research that was unfolding on the endocannabinoid system, on various components of the cannabis plant, but in particular CBD, which was really generating amazing reports within the scientific community, but it was only within that community. And we saw it as our role, Fred Gardner and I, as journalists, to launch Project CBD to inform the medical marijuana community about these other possibilities of the plant. And the big focus was really on disabusing people of the notion that it was really all about THC.
Yep.
In the early days, THC. The drug warriors would hoist THC as the evil cannabinoid, and on our side we're saying amazing medicine. But when the CBD molecule enters the picture, it changes the name of the game in a lot of ways, because we suspected very early on it could have a significant political impact. How would the drug warriors respond when you can now have strains and products that are low psychoactivity or no psychoactivity, and they're cannabis medicines with profound effects? How are they going to respond to that? Well, we see how they responded. It's called CBD only law. It's amazing when you think of reefer madness. It's the evil weed, and we're in this big cultural shift. And now we've got it. It's still the evil weed, but we've got a good part. It's called CBD. So that's kind of a measurement of how far we've come, maybe at least in Alabama and Utah and Kentucky. But we've come a lot farther here. The plant, at Project CBD, we're all about the whole plant. These days we have to keep reminding people it's not just about CBD. People have a lot of misconceptions about CBD, driven by greed, because of these companies that are looking to make money from promoting the low THC or the pure CBD powder they got now, which is of dubious clinical value. So you've got a whole, there's a lot going on right now in an industry, a very dynamic time. And our role at Project CBD has always been responding to the shifting dynamic and trying to address what's most important. It seems, once again, education is paramount. But just to very quickly mention a few projects we're involved in that go beyond sort of simply educating about the plant or the molecule. One project is a tissue culture project, and this directly relates to the theme of our gathering as the Sonoma Growers Alliance. Project CBD is aligned with the group that's tissue culturing the first ACDC starts, so that for the first time growers can grow from a tissue culture start, meaning it's a very strong plant, no viruses, no bugs, because it goes through a process where you can take one speck of the plant and make thousands of the same thing. So we're developing a tissue culture library. We'll have over 100 strains just of the CBD-rich strains. So that's one project we're involved in that's exciting. The other is that we had an offer from folks in Sonoma County who are involved in extracting cannabis oil on a pretty major scale, that any grower who has excess or what they want to donate as a flower top or trim, whether it's CBD rich or not, and wants to see it extracted and made into oil, they will extract it and make it into oil for free, and then give it away to veterans groups, breast cancer survival groups, or whoever needs to be made available this kind of medicine. So any growers in the area that want to be part of that effort, Project CBD will help facilitate that. And finally, the other project we're involved in, very exciting, and has to do with honoring the whole plant, welcoming cannabis back into the pantheon of medicinal herbs, where it's always belonged, but it was excommunicated for a while. And we're going to have a cannabis cultural center at the Real Good Solar Living Institute in Hopland, and have the first solar-powered dispensary, and a cannabis museum, and medicinal plant walks with broader medicinal native plants, and so forth and so on, many different things. And it's a really exciting project, and it's our way of presenting to the world, particularly the post-prohibition world, assuming we pass the vote next year, as I hope. When the tourist buses come up to cannabis country, they'll stop there and see cannabis presented in this broader light as a medicinal herb, because ultimately we think that's going to be the big struggle, how to define medicinal cannabis in a post-prohibition world. Will it be regulated by the Liquor Control Board? I hope not. It's going to be regulated as a big pharmaceutical kind of thing? I hope not. It has to be regulated in a way that's conducive to its essential nature as a whole plant medicine. And that's where I see the big struggle coming, and that's going to affect everybody who's involved in growing cannabis in this region.
Thank you, Martin. So myself, I have started as a patient. I laughed yesterday when a friend of mine compared himself to the Forrest Gump of cannabis. And I see myself that way a lot of times, where I've just walked into history making things happen at a time that I didn't realize things were changing so much. I have been active with ASA since their inception here in Sonoma County for 10 years. I work with Sonoma ALLIANCE for Medical Cannabis, Sonoma ASA, as well as Citizens for Responsible Access, 3 cannabis groups based here in Sonoma, hosting debates for district attorney, for board of supervisors, doing court supports, hosting monthly meetings. I also teach politics and history at OU, Oak Street University. I'm also a legal assistant and formerly on the Board of Supervisors Task Force of San Francisco. I think that it's really important to talk about the patient-cultivator relationship, because cultivators are who we're relying on most to make this system happen. When we voted for Proposition 215, most of us were thinking about the terminally ill patient that's bedside that needed this cannabis for their survival. And when we talk about the bills that are upcoming in the state, and we have 13 that will affect cannabis, or the water board regulations that are going to require mandatory registries, or even legalization measures, we have to make sure that we're thinking of patients as #1 priority, because those are the people that we have implemented this law to help. On behalf of ASA, we've tried a lot of different ways to reschedule cannabis, everything from lawsuits to congressional bills, to working with the American Herbal Product Association, who's recommending that we take cannabis off schedule altogether and let it be regulated like all other herbs, as other medicinal plants are. But I do want to thank all of the people in this room that perform civil disobedience every day on behalf of patients. For those of you that are cultivating and that are providing for us, I recognize the risk, both state and federally, to be able to help patients that are in need. And so I encourage you guys to keep doing what you're doing, because things are changing, and eventually we're going to get to a place where we're not doing something that we have to hide in the shadows, and where we can be within the light to show that what we're doing is for a good cause. Not only are we helping people's quality of life, but we're also saving lives. There's so many people that are relying on this just to be able to live healthy. I've stopped over 30 different medications and just used cannabis for my conditions, so I can't even tell you how grateful I am. And it's really been my role to make sure other patients have that access as well. I encourage the cultivators that are in this room to take part in compassion programs. So many patients can't afford the medicine or are depending it. They don't have the energy or the place that they can cultivate for themselves. And they're relying on you guys for that quality of life. And I think it not only protects you guys when it comes to court, when it comes to developing good collective structures, I think it brings the whole structure full circle, because this is what this law was intended to do. So I thank you guys for being here, and we're going to open this up to Q&A here in the room. Is there anyone that wants to start? Yes?
I'm curious about the tissue culture, collecting and improving the strains, or at least improving them back to where they originally were. How accessible will that be to common folk? And how would we access that in the future?
I think it's the wave of the future. I don't think it's immediate. I mean, it's just the beginnings of this stuff actually being available for people to growers to access. But I know that there's a focus on one strain right now. That's the ACDC, which is a CBD dominant strain, about 20% CBD by dry weight. It's a great strain to grow if you want to harvest it for CBD-rich oil. So that's like the workhorse strain for Northern California. I know that there's interest in doing this for many different strains, CBD-rich and otherwise, but it takes, it's a very exacting process. You run into problems with numbers, plant numbers, very, very quickly, because you can go from 3 tissue culture things to 3 million, theoretically. But it's happening. There's more than one group interested in tissue culture, but I know that the first tissue culture ACDC starts will be available in Sonoma County and up at Hopkins when the Emerald Farms dispensary opens, which will be soon. So, but it's a little bit, it's not timed optimally for the grow season. That's just what it is, It's a lot of trial and error to make it. It's a difficult process to master the tissue.
Can people contract for that service?
Can people contract for the service? Dr. Hergenrather asked. Yes, I would suppose in theory, but I think it's a little bit early on. I think in the future, theoretically, you'd be able to offer and say, this is real sour diesel. I mean, not, you know, the 1 at 20 sour diesels popping somehow, and it's a real healthy plant to start with. And you can do that for any strain theoretically, and I imagine you've got all sorts of issues of copyright and trademark, which is really weird in the cannabis world right now for actual genetics. But it's, you know, who knows how it's going to play out. But I just think it's going to be happening, but probably a few years down the road in a big way.
Yes?
How theoretical or true is it that you could grow organic indoors?
For those of you who didn't know the question, it's related to how feasible is it to grow organically indoors?
Harder than outdoors.
Much harder than outdoors, I think it's fair to say. Yeah, I don't hear about anybody doing 100% organic indoors. It probably can occur, but the conditions would have to be ideal. As you well know, too much heat, too much moisture is just going to encourage bugs, whether they're molds or mice or whatever. So it's really hard to grow indoors without that. And I don't know of anybody providing an organically grown indoor medicine. It may occur, but not to my knowledge.
You should ask for hands in the room.
That's a good idea. Show of hands, anybody achieving that? 100% organic indoors. Nice.
Congratulations.
Nice. There's a half dozen of you. I applaud the effort. It's not easy. That sounds like something that can be addressed at one of the other panels today, as far as maybe your the methods in which you're able to achieve that.
Does anyone else in the audience have a question? Yes?
I would just like to thank you guys for all the hard work over all these years, and that I have been a grower for 15 years, and I'm just excited to be able to say that.
Any other questions in the room? Yes?
Can you speak to the development of patches and where that's at and where it might be going, the improvements that need to be made?
Transdermal patches.
Yeah.
Well, I can tell you that the patent is held in here by an individual in Sebastopol, but because he was not really willing to make the, he tried to get on with the feds permission to put the patches on mice, and they said, no, you're not allowed to do that. So he had backed off for other business reasons, taking advantage of the patent he held for using patches as medicine. They have the technology. Now, at the same time, in Colorado, there's a company, Mary's Medicinals, who is doing it, and they've gone on to provide patches. And I understand they're very good. I think there's patches and there's patches. I've got a Band-Aid in my left ear that I put on overnight with concentrated oil on a spot Band-Aid, but I'm really using it for topical treatment of a sun-damaged keratosis. And cannabis oil works very nicely for that if you leave it in contact. Other people are using cannabis patches with the idea that there's a small, slow diffusion of the cannabinoids into the bloodstream to treat cannabis-related conditions. And that's more of a systemic effect of a slow release of cannabinoids into the body. So that's really a different application. So I think it depends on what you're trying to achieve and how a patch is designed in order to best utilize the cannabinoids.
If I could speak on that as well from a practical, number 14 doesn't seem to be working. Mic 14?
Mic 14?
We do actually have Mary's Medicinal Patches now. It's in the Bay Area. That came from Colorado, as well as RX Green Patches. My understanding from patient feedback is RX Green Patches are a natural patch where they don't use chemicals. The feedback I've heard from patients, they're not effective. Mary's Medicinals is an excellent patch. They are pricey. They retail at about $16 per patch, and they last about 6 to 12 hours. I am hearing some feedback from some of the senior population that it is, they're having quite a bit of skin reaction at the site.
Did you say the RX green patches are not effective?
That's what I've been told, that's not my personal opinion.
Okay.
Did you have another question?
No, I just knew about that.
Sarah, would you explain why you refer to the growing, I guess, as civil disobedience?
Well, unfortunately, I've been active in this movement for 13 years, and I've seen an escalating tactics with the federal government, not only going after growers, dispensaries, landlords, even legitimate programs like the 9.31 program in Mendocino, where law enforcement was creating regulations for people to be able to have a permitted program. So the irony is that we are in this gray area right now between being legal in 39 states now, having passed some kind of medical bills, but we don't have the same protections when it comes to our court systems, when it comes to our district attorneys, when it comes to our political figures who are making decisions on our behalf. Here in Sonoma County, we had 65% of the vote for Prop 19 for legalization. We still have 6 bans in cities that won't allow dispensaries. Like we're still in a transition period, and I'm concerned that there are people that are getting caught both in state and federal court because of it. Any other questions? Yes?
I was wondering if we could just talk about the nuances and difficulties in regards to treating children with cannabis, as far as ethically, and also any tools that might enable parents to better communicate with other pediatricians and physicians that are maybe more skeptical.
So the question that we have is about cannabis use for children, especially when it comes to oils, and the skepticism that might come with that.
Well, I can take off with that. I don't have any problem in treating any child that has, or infant even, that has a need for cannabis. From failure to thrive, to seizure disorders, to autism, to cancers. I think there's a great use of cannabis in children. I think, we'll probably end up with an adult use bill in California that we'll have an opportunity to vote on in another year. But I think for kids, it's still going to be a physician-recommended use of cannabis. Now, we've got the feds bearing down in this area as well, in the way that CPS is funded and going after mothers and infants in the hospitals. They're being P-tested when they're going in to deliver babies. They're, in some states, losing their babies to CPS before they even get out of the hospital because the mother's testing positive for cannabinoids. So there's quite a fear in that community at this point in these parturient mothers going in and getting tested and running the risk. I've got mothers of autistic kids that won't tell anybody, even their closest friends, that they're using cannabis for their autistic kid, even though there's a dramatic change in behavior because of fear of CPS coming in and taking their kid. Similarly, I have a patient who has had a marvelous response to cannabinoids for brain tumor, and the brain tumor basically melted away with cannabis only as the therapy. But they too aren't telling their doctors. It's a miracle baby to the doctors. They have no clue what's going on because of fear of CPS coming in. So it is a problem, and it's a problem right here in Sebastopol because our local Peace and Medicine is afraid to give cannabis to children. You have to be an adult to get to use the dispensary. And so parents are going to San Francisco or going elsewhere where they can get cannabis that's been recommended to a child. There's nothing in the law that says anything about this. It's Californians have a right to use cannabis if approved by their physician. So it's not a problem if I send a patient out with a recommendation, they're 1-year-old with a seizure disorder or a brain tumor or whatever, they can legally use cannabis. But if the problem comes into everybody else being fearful about the feds coming into a dispensary or about the CPS coming into the home and causing great hardship to those involved. So that's part of the answer to the question. Do you have a more specific follow-up?
More so, my nephew actually lives in Oregon, has cerebral palsy. They've been traveling down here to actually do the Vignal method in San Rafael, which is sort of a more, sort of a newer method, a little conventional. And as they've talked to their pediatrician and some of their neuroscientists or some of their doctors about weaning them off Keppra, which is an anti-seizure drug, and they're, think that they've gone off the farm, and as a parent, you go to this doctor who's been leading them through what has already been a very traumatic experience through the, traumatic birth situation. And they just have a lot of fear, and they actually sent me, I told them I was going to be down here, and said I would ask a couple questions about that, because they basically have to break from what their doctors are telling them, even though in their hearts they feel that the Keppra is actually stronger, and that it's potentially, not necessarily what they think is best, but it's certainly something that they've gotten a lot of pushback from their doctors.
That's understandable. One thing I would say to that is we tend to be looking to CBD and CBD dominant, if not even CBD only strains and medicines for children and infants, and I think this is a political choice. Really, THC and conventional marijuana is good for all conditions, and it was a political choice to take the THC out, and I think you have a much more potent medicine, a much more efficacious medicine. It works better if you have a combination of THC and CBD. So I encourage people to not throw the THC out when it comes to treating children. In both pain and in tumors, we know that when you blend them together, you have a much more effective medicine in basic research. And that's probably going to prove to be true across the board for seizure disorders and really any other inflammatory condition. I think you're going to find that the blend of cannabinoids is a more effective medicine.
So we have 7 minutes left, so we're going to take a handful more questions. Go ahead.
I have a family member who's severely autistic, and you mentioned some positive results with and I was wondering if you could speak a little bit more about the autism link.
About the
Autism link?
Oh, sure.
Thank you.
How about either of you have a comment? I don't know about
That's a good question for a doctor.
It works. It changes everything. In the kids that I've been involved in, they've gone from not wanting to leave the car to go to a school environment, a special school environment, or even a regular school environment, to now that they're on cannabis product, they pop out of the car and run to the classroom and run home to mom at the car on the way home and want to tell mom. Now they're speaking when they weren't. Now they can articulate better. I don't know that it'll work as well for everybody, but I see really dramatic effects. There's no medicine that works better than cannabis for autism, in my opinion.
And if I could also add, I think kids don't handle THC the same way that adults do. I don't know if you would agree or disagree, Jeff, but they don't seem to have the same, they can take higher doses, and I noticed they don't appear like I would if they took that dose. The THC is really important in these kids for the sleep and the appetite and the pain.
And I also learned from Dr. Courtney that if you're not raising the THC past 160 degrees, you're not necessarily having a psychoactive effect. So that's really a good way for children to be able to have access to it, where they're not going to be delusional or having an overdose of cannabis, because I know that's a major concern for some of these parents. We've got a handful of questions left. Go ahead.
Thank you. Mr. Lee, earlier you were talking about creating extracts and oils. Of course, that requires a large amount of actual plant matter. And I was wondering, is there anything in the works, legislative-wise, that will protect growers who produce, massive amounts of quantity in order to make the extracts?
It's a good question. The main point being that to make an oil extract from cannabis blend, you need a lot of plant matter to make a little oil. If you're starting with industrial hemp, you need a ridiculous amount of plant matter to even make less oil. So definitely cannabis is the place to start, but You might be better.
So on
positioned
Monday,
to
we're
speak to that.
doing a California Lobby Day hosted by Americans for Safe Access. Last year, we had 300 of us defend on the Capitol, descend on the Capitol. And I know that there's 13 bills now. I can only think of a handful that are going to affect patients. A number of them are regulatory bills, so any large grow is going to be affected by that. I also know that they implemented a bill that would give more criminal penalties to people that are manufacturing butane-style hashes. And so that's basically for any parent. If there's any minor in the house under the age of 16, they have more criminal penalties at this point. So yeah, there are some concerns about extraction. And because CO2 is such a new process, we don't have a court determination that says whether that's allowed or not. With 13 bills that are in Sacramento right now, if we have multiple of them passing, we could see bills that conflict one another or require multiple registration systems. So yeah, it's definitely something to pay attention to. Feel free to pick up a flyer, even if you're not going to go to the lobby day. It has links to the legislative bills that are going to be presented this year. ASA's main goal this year has been challenging the fact that cannabis patients are being kicked out of hospitals that are waiting for transplant organ donations. And they're kicked off those lists, which is basically a death sentence for those patients. So we put the majority of our energy into protecting patients because that's a life-saving matter, and we're definitely hoping to see that pass this year. Question in the back, yeah?
Yeah, my cousin is also a severe autistic. You might mention what ratio of THC to CBD and anything else would you recommend?
Can we talk about what ratio in CBD to THC people are needing?
I would probably aim for 1-to-1 to start out and tailor your dose as needed. As Eloise said, I don't see a problem with THC in the kids. They giggle and fall asleep, but they don't have a complaint.
I've spoken to epileptic mothers with children as young as 12 months old, and they said that even though most of the products that they're trying to use are high CBD at 20 or 25 to 1, which seem very high to me, all of them are using a 50-50 ratio at least once a day. So they're definitely getting a beneficial effect from having both of those cannabinoids together. I'm going to take one last question because we've got 3 minutes left. Here next to Dragonfly.
Oh, hi. Many of you may have seen the program on Dateline last Sunday about cannabis and treating seizure disorders in children and the big legal battle in Virginia in order for them to be treated. What really interested me about that program, however, was that the lack of studies or research about what may be the fallout or side effects, and the fact that basically the federal government is standing in the way of that research. So can you comment about that?
So I just spent my 3rd year lobbying in Washington, D.C., and we just introduced the Careers Act, which would cover 7 different things, including access for VA veterans. It would take CBD off schedule. It would reschedule THC from Schedule 1 to Schedule 2. And that's a controversial subject. A lot of people are concerned about it falling into pharmaceutical and big companies' hands. But in ASA's opinion, any move in the right direction is the right direction. We also think that that is also going to open the door for research. And once we can show people how harmless this is, that there's no mortality rate involved with using it, then I think that's definitely going to encourage us to come down schedule altogether. I also want to say that taking it off schedule and making it alliances with American Herbal Product Association isn't necessarily our voice speaking, but it's another well-recognized voice that's asking for something that's going to benefit all of us. I didn't see the Dateline special that you're referring to, but I recently watched the Sanjay Gupta specials, and I was amazingly impressed by them. The most recent one shocked me the most because he showed fields 2 years ago at the NIDA program that were completely empty, that are now completely full. If the federal government's anticipating needing this much cannabis, it shows us that we're likely going to be making a move in the direction very quickly. Should we cut off or should I take one last question? Perfect. Well, I'm sorry I'm going to have to track these wonderful people down in person and start a conversation and ask them your questions in person. And I'm going to say goodbye to this panel and introduce the next one. Melanie?